Good evening, everyone, and welcome to our August Conversation from the Heart, American Heart Association series on South Asian heart and brain health. We're very excited to continue this series. As you know, we have this monthly, the first Tuesday of every month generally, unless we are trying to work around a holiday. So we will also be recording all of this series and sharing them later. And so if you want to go back and look at past recordings, you are able to do so. If you have any questions during the presentation, please feel free to write them in the chat box and we will answer them at the end of the presentation. I'd like to introduce Dr. Ami Bhatt, who is the head of outpatient cardiology and telecardiology at Massachusetts General Hospital, as well as an associate professor of medicine at Harvard Medical School. She serves on our Boston Board of Directors, as well as our Go Red for Women executive leadership team. Dr. Bhatt, I will turn it over to you.
Great. Thank you so much, Meg. Very excited to have everybody with us tonight. Thank you for spending your summer evening here. We have a couple announcements. One is that we are very proud to say that the National American Heart Association has actually taken on our Boston-based effort here with the From the Heart Conversation series. And so as we come into September, this will be a nationally recognized program now, further, showing the importance of us supporting South Asian heart health, both in terms of educating our community, also supporting research. And with that, it's a real honor to have Dr. Nilay Shah here today. He is an MD and a Master in Public Health, an Assistant Professor of Cardiology and Preventive Medicine, and he's a practicing general and preventive cardiologist in the Bluhm Cardiovascular Institute at Northwestern University in Chicago. His research focuses on identifying disparities in and adapting interventions to prevent cardiovascular disease in South Asian populations, with particular attention to earlier life cardiovascular disease prevention. He is the principal investigator of Masala 2G, a Masala offspring study to study heart and metabolic health in second-generation South Asian American young adults. We've spoken very much over the past year about the Masala study, and are very interested in the fact that we are not only looking at our original generation of first generation, but also thinking about our second generation and how environment also affects us in addition to our nature. And so I think this is going to be a really exciting talk. I know that there are many people who are watching today, but there will also be many who are watching in the future. And so to those of you who are watching at a later date as well, and maybe don't have a chance to ask questions today, Dr. Shah has already said that he is more than happy to be reached out to, and we'll have his contact information for you as well. So with that, Dr. Nilay Shah, so exciting to have you with us. I will turn off my video and mute, and maybe you want to try and share your slides.
Thank you very much. Let me go ahead and share my slides here. And Dr. Bhatt, can I confirm that you can see this okay?
That looks perfect.
Okay, great. Thank you. All right. Well, good evening to you all. Thank you for taking the time to attend the webinar this evening. And my thanks to Dr. Bhatt, the seminar organizers, and the Go Red for Women campaign from the Boston American Heart Association for organizing this webinar series. I'm Dr. Nilay Shah, as you heard. I'm a general and preventive cardiologist at Northwestern Memorial Hospital in Chicago, and an assistant professor of cardiology and preventive medicine at Northwestern. And I'm pleased to speak this evening about protecting your heart health early, focusing on preventing heart disease in young adult South Asians. This evening, I'll be talking about what we know about heart disease prevention for young adults, why focusing on the young adult period of life matters, and what we've learned about heart disease risk factors in young adult people of South Asian ethnicity, and finally, steps you can take to protect your heart health starting early. And I look forward to our conversation and discussion at the end of the presentation. So please feel free to leave questions in the chat box or Q&A, and we'll try to address those. Before we begin, I'll note that I have no disclosures related to today's conversation, and my research is funded by the National Institutes of Health. So as many of you already know, heart diseases, often referred to as cardiovascular diseases, which can include heart attacks or coronary artery disease, heart failure, abnormal heart rhythms, or stroke, have a large burden worldwide. This chart shows the leading causes of death in the world just a few years ago in 2017. And cardiovascular diseases caused the highest number of deaths by far, accounting for almost 18 million deaths in that year. And during this last year, we've all been confronted with the challenge of COVID-19, and national and global statistics indicate that the burden of heart diseases still remain high and may have even increased during this time. Now, potentially the most effective means of reducing the burden of heart diseases is focusing on prevention, which we'll discuss here this evening. The good news is heart disease is largely preventable. Global studies tell us that about 80% of heart diseases can be prevented by optimizing a set of cardiovascular health factors that influence a person's risk for heart disease. While there are many things that can contribute to increased risk for heart disease, these 7 factors represent things that individuals can work on improving or optimizing. These factors include blood pressure, cholesterol, blood sugar, exercise, diet pattern, weight, and smoking. One of the most compelling reasons to think about heart disease prevention starting at a younger age is that it's often easier to maintain good levels of these factors rather than trying to improve on these factors if they're at a less healthful level. So for example, it can be harder to quit smoking once you've already started compared to not starting in the first place. However, that said, it's never too late to work on addressing any of these heart health factors. And as you'll also see, it's also never too early to start working towards good heart health. These are data from a population study from this year that starts to help us understand why it's important to focus on heart health in young adults. The data in this graph represent data from about 5 studies representing about 18,000 total individuals. And in this graph, along the vertical axis represents the number of cardiovascular health factors that are good or optimal. In childhood and adolescence, most individuals have relatively high cardiovascular health scores, indicating good levels of most of the factors that we discussed. But you can see that starting in late adolescence and young adulthood, around aged 18 to 20, people's cardiovascular health starts to decline. And this continues through young adulthood into middle age through age 50. This pattern provides compelling insight that young adulthood from about 18 to 40 years old is a critical time to maintain heart health. As these cardiovascular factors, again, blood pressure, cholesterol, blood sugar, exercise, diet pattern, weight, and smoking, as they decline, it can become harder to get back to good heart health. And why does this matter, really? Well, in this study published last year of US adults who were aged 18 to 30, those who had high or good cardiovascular health in young adulthood had an 86% lower risk of cardiovascular disease by the time they reached their 50s, compared with young adults who had low or poor cardiovascular health factors around age 18 to 30. Now, many common heart diseases like coronary artery disease take years to develop. So we don't often think about heart disease prevention that early, but we need to. We need to think about heart disease prevention years before cardiovascular disease events like heart attacks and strokes may occur. And there's a lot of benefit to be gained by maintaining heart health throughout young adulthood. In this study, the researchers looked to see how long people lived if they reached age 45 with all optimal heart disease risk factors, compared to having cardiovascular risk factors that were not optimized, like having high blood pressure or diabetes or overweight. The researchers found that young adults who reach age 45 with optimal cardiovascular risk factors on average lived 15 years longer than those with cardiovascular risk factors at age 45. Now, all of these research findings demonstrate the critical importance of maintaining good cardiovascular health starting in young adulthood. What's more, there's growing evidence that these questions about heart health are especially important in people who are of South Asian ethnicity. And when I say South Asian, I'm referring to people who identify as being of Indian, Pakistani, Bangladeshi, Nepali, or Sri Lankan ethnic groups, or having ancestry from these regions. People who are South Asian have higher rates of heart disease compared with people of other race and ethnic groups. And this graph on the right was recently published in a study by Dr. Anirudh Patel and Dr. Amit Khera, who actually presented at this webinar just a few months ago. These data are from several thousand individuals who live in the United Kingdom in a study called the UK Biobank. Over time, across the horizontal graph axis, the occurrence of cardiovascular disease, most commonly coronary artery disease, heart attacks, or strokes was higher in South Asians in the UK compared with individuals of European ancestry. But it's not just the rate of heart disease, it's the onset of heart disease that can be worse in South Asian individuals. On average, people who identify as South Asian have onset of heart disease about 10 years earlier than people of other groups, frequently starting in their 40s or 50s. Now, while heart disease events like heart attacks and strokes are still fairly uncommon in people in their 40s or younger, the rate of heart attacks in young adults in their 30s, for example, and particularly in men, is 3 to 5 times higher in South Asians compared with those in other Asian groups or white individuals. Now, given these data, guidelines from the American Heart Association for treatment of patients and assessment of an individual's risk for heart disease identify South Asian ethnicity as a risk-enhancing factor, meaning that if all risk factors were otherwise equal, a person of South Asian ethnicity should be considered at higher risk for heart disease. There's clearly an important need to think about heart disease prevention for young South Asian adults. And I'd like to talk a little bit about the cardiovascular health factors that are particularly important for young adult South Asians and what any of us can do to protect our heart health. To be sure, each of these 7 factors is very important to help protect your heart health across young adulthood. But this evening, I'm going to focus on cholesterol, blood sugar, exercise, and diet pattern, which may be particularly important for young adult South Asians. I'll outline a little of what we know about these factors in people of South Asian ethnicity and discuss some of the strategies that you can take to optimize each of these factors. And to provide some context for our conversation about these heart disease risk factors, I'll introduce you to the story of this family. I've changed the names, but these stories are similar to some of the families I've seen in my preventive cardiology clinic. Rahul and Neha are siblings who want to learn more about how to protect their heart health. A few years ago, their father had a heart attack at age 47 and had a heart bypass surgery at that time. Now, Neha is a 31-year-old woman. She has a busy job and she works late hours, so she often has to partner with her husband to get takeout for dinner because they don't have time to prepare food at home. She's currently pregnant and she was recently diagnosed with diabetes in pregnancy. Her brother Rahul is a 28-year-old man. He already knows he has high cholesterol. He works in an office, so he doesn't get a chance to do a lot of exercise. And during the pandemic, he gained about 20 pounds. You can see that each of these young South Asian adults has some factors that may contribute to their risk for heart disease. So what should Rahul and Neha do to protect their heart health and prevent heart disease in their lifetime? First, I'll talk about the so-called clinical factors, which are heart disease risk factors that you'll often discuss in your primary care clinic or with a preventive cardiologist. First, we'll focus on cholesterol and blood sugar, and I'm going to pause. In this era of Zoom, you can hear the ambulance outside, so I'm going to mute for just a moment. I'll be back in about 10 seconds. Okay, it's quieted down. I apologize for that. To start with, let's address the question of what is cholesterol. Cholesterol is a fat-like substance that comes from food and is made and stored by your body. In food, cholesterol really only comes from animal sources, but it's important to know that you can still have high cholesterol if you are primarily vegetarian or follow a plant-based diet. For example, if you consume dairy or eggs, or in some cases, there are genetic or inherited conditions that can lead to high cholesterol levels. When you get a standard cholesterol test, the results you see will include measures of total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. Now, there's a lot of research about each of these measures of cholesterol, but you'll most often hear about HDL, LDL, and triglycerides. LDL cholesterol is often considered the so-called bad cholesterol because it contributes to fatty buildups in arteries, also known as atherosclerosis. This process of atherosclerosis can narrow arteries and increases the risk for heart attacks, strokes, and peripheral artery disease. HDL cholesterol is often referred to as the good cholesterol because a healthy level may protect against heart attacks and strokes. HDL carries LDL or bad cholesterol away from the arteries and back to the liver, where the LDL is broken down and passed from the body. Triglycerides are among the most common types of fat in the body. They store excess energy from your diet. A high triglyceride level combined with high LDL or bad cholesterol and low LDL or good cholesterol is linked with atherosclerosis in the artery walls, which can increase the risk for heart attacks and strokes. South Asian individuals tend to have lower HDL and higher triglyceride levels compared with people from other groups. This pattern is consistent with what you may have previously heard called the metabolic syndrome, which refers to a set of factors, including these cholesterol measures, weight and body composition, and your body's handling of blood sugar. Research suggests that South Asian individuals genetically have similar LDL cholesterol numbers compared with people of other groups, but their LDL cholesterol may be of a higher risk type that can lead to higher risk for atherosclerosis. It's not yet clear exactly how LDL cholesterol composition in South Asians is related to their heart disease risk, and this is an area of active research and study. So how should you address cholesterol as a potential risk factor for heart disease? To start with, it's recommended to track your cholesterol levels. You can do this with your primary care clinic or visiting a preventive cardiologist. A heart health clinician can measure blood cholesterol and help you understand what your individual numbers mean. Especially if your cholesterol levels are not optimal, it can be helpful to track your cholesterol levels over time. Generally speaking, it's recommended to begin screening cholesterol levels starting in about the age of 20s. These recommendations can vary, especially for screening earlier or increasing frequency of cholesterol checks, depending on other factors, like if you have a family history of early heart disease, or if you have evidence of a genetic condition causing high cholesterol. Your primary care clinician or your preventive cardiologist can help identify if you belong in one of these groups. If you have high cholesterol, what should you do? There are a couple of cornerstone recommendations. Making smart diet choices can help lower your cholesterol levels. Generally speaking, a primarily plant-based diet consisting mostly of vegetables, fruits, whole grains, beans, legumes, and lentils, and plant-based proteins is optimal. For individuals who are not vegetarian, lean animal proteins such as skinless poultry or fish can also help support healthy cholesterol levels. Limiting sugar-sweetened beverages such as sodas and added sugars, such as found in pastries, fatty or processed meats such as deli meats, full-fat dairy, eggs and especially egg yolks, and tropical oils such as coconut oil can also help lower cholesterol levels. Knowing the types of fats that you're eating can also help. There are fats that are, generally speaking, more healthful than others. Healthful fats are unsaturated fats and can include fats found in foods like olive oil, avocados, nuts, and beans. Whereas saturated fats are closely linked to higher risks for heart diseases. And so reducing saturated fats will help support healthy cholesterol levels. Saturated fats are often found in animal products, such as meats, high-fat dairy, and other processed foods. Getting more physical activity will also help. We'll talk more about exercise in a few minutes, but spending more time being up and moving around can certainly be helpful. Smoking can help lower the good HDL cholesterol levels and smoking will raise your risk of heart disease. While smoking rates are relatively low on average in South Asian adults, there's no amount of smoking that's considered safe. And so we recommend not starting smoking if you don't, and quitting altogether if you do. Finally, it may be appropriate for some young adults to take cholesterol-lowering medications, but it's important to note that not everybody needs a cholesterol-lowering medication, and we'll talk briefly about that. If your cholesterol levels are not optimal, it's recommended to speak with your primary care physician or preventive cardiologist about strategies for addressing your cholesterol levels. To help decide whether a cholesterol-lowering medication would be appropriate for you, and to have a conversation about the pros and cons of medications in young adults, your doctor will evaluate your cholesterol levels and will ask you about your family history of heart disease or other cardiovascular disease events. In certain cases, there are specific tests that can be obtained to help inform whether it would be appropriate and helpful to start a cholesterol-lowering medication. Examples of these tests include a coronary artery calcium CT scan, which evaluates for evidence of advanced or calcified plaque in the heart arteries, or a lipoprotein(a) blood test, which is one measure for inherited risk for heart disease. There are several considerations about who should get these tests and who should not get these tests because they're not likely to be helpful. These tests aren't right for everyone, so I would strongly encourage you to have a conversation about whether these tests might be helpful for you with your doctor. The next factor I'd like to talk about is thinking about blood sugar. This is particularly important in focusing on heart health for young adults in the South Asian community. Just like with cholesterol, the first step in managing your blood sugar is to understand what your levels are and what causes blood sugar levels to rise. Sugars in the foods that you eat and drink can get converted into blood sugar or glucose in your stomach and digestive system, then get absorbed into your bloodstream. It's important to know that carbohydrates are more complex form of sugar that get broken down after eating and can also increase your blood sugar levels. So foods that are high in carbohydrates, such as breads, pastas, and rice, should be consumed in moderation. High blood sugar levels over time can lead to a condition called type 2 diabetes, which occurs when glucose builds up in the bloodstream and instead of going into the body's cells. The body develops resistance to insulin, which helps move glucose into cells. And over time, this resistance to insulin can result in a high blood glucose or blood sugar level. High blood glucose levels can have several consequences. In addition to the development of heart disease, high blood glucose can lead to diseases of other organ systems, including the brain, the kidneys, the eyes, and the nervous system. High blood sugar and diabetes stand out as a strong risk factor for heart disease in South Asians. In fact, emerging research suggests that diabetes might be among the strongest risk factors for heart disease in people of South Asian background, in part because diabetes is very common among people who are South Asian. And also, there's starting to be some evidence that diabetes contributes a particularly large portion to the increased risk for heart disease in people of South Asian ethnicity. While estimates vary somewhat, data from the US indicate that up to 1/3 of South Asian American adults have diabetes. These rates are about 30% higher than the rate of diabetes in white adults in the United States. Not only this, but South Asian women are particularly at high risk for a specific type of diabetes called gestational diabetes. Gestational diabetes, or diabetes that occurs in pregnancy, significantly affects women of South Asian ethnicity. Data from the National Center for Health Statistics in the US show that Asian Indian women in the US have the highest rates of diabetes in pregnancy compared to all other groups. The rate is about 130 women per every 1,000 live births. This rate is more than twice that of white women. South Asian women with gestational diabetes have a 3 times higher likelihood of developing diabetes later in life. And recent population data show that women with gestational diabetes have a higher risk for heart disease later in life, even if they don't go on to develop diabetes after pregnancy. This is one example of a specific factor in South Asian women that needs more attention for prevention and treatment, especially since, as you can see in this graph, over the last decade, the rate of diabetes in pregnancy increased about 40% in Asian Indian young women in the United States. So how should you keep ahead of your blood sugar levels? To start with, it may be helpful to obtain and track levels in partnership with your primary care physician, particularly for individuals diagnosed with type 2 diabetes, or in some cases pre-diabetes. Monitoring your blood sugar levels with a home monitor can help. A fasting blood sugar level less than 100 milligrams per deciliter is normal in the healthy range. A level 100 to 125 may indicate pre-diabetes, or can indicate an increased risk for developing diabetes. A fasting level at or above 126 would suggest type 2 diabetes and may indicate that a person has an increased risk for heart disease or stroke over time. Sometimes your doctor may check a blood test called a hemoglobin A1C, which is a test that helps understand what your blood sugar levels have been over the last several months. If your average blood sugars over the last several months have been elevated, your hemoglobin A1C level will also be elevated. These numbers and recommendations are slightly different for another type of diabetes called type 1 diabetes, which I won't discuss here and is a separate discussion. So what are things that you can do at home to manage your blood sugar, even if you don't have diabetes? You'll probably recognize a lot of overlap in these strategies that you should take to help keep your blood sugar in a normal range, and with the strategies that I presented for controlling your cholesterol levels. Making smart eating choices and staying physically active are the mainstays for preventing or treating diabetes. These strategies will also help manage weight, which can contribute to the risk for diabetes. In the case of gestational diabetes or pregnancy-associated diabetes in South Asian women, it's especially important to maintain good heart health before becoming pregnant. Recent research shows that having good heart health before pregnancy is associated with a lower rate of diabetes in pregnancy and lower rates of complications in pregnancy. So focusing on heart disease risk factors starting in young adulthood can help set the stage for a healthy pregnancy. For young South Asian women who do become pregnant, it's also recommended to make sure that you are talking with your obstetrician early about diabetes screening. Diabetes screening should be a standard part of all prenatal care in the US, and several guidelines actually encourage earlier screening for women who are of South Asian ethnicity. So we've talked about some of the clinical risk factors that may contribute to heart disease risk that young adult South Asians should pay particular attention to. Next, we'll spend a few minutes talking about exercise and diet in a little more detail, as these are behaviors that young adults can establish early healthy habits for now to protect their heart health across their lifetime. First is exercise or physical activity. On average, South Asian adults participate in less exercise and lower intensity exercise compared with adults in other groups. There's not a lot of data about exercise in young adult South Asians in the US, but in the UK, second generation younger South Asians do participate in more exercise than first generation or immigrant South Asians who tend to be older. But even despite this, second generation South Asians are still participating in less exercise compared to other groups in the UK. The recommendations for exercise are simply stated, but they can be a challenge to implement. In the US, it's recommended that adults get 150 minutes of moderate intensity aerobic activity each week. So for example, 30 minutes a day, 5 times per week. This can include walking, jogging, or biking, or 75 minutes of vigorous intensity aerobic activity, such as running, swimming, or playing a team sport. Increasing time, distance, amount, or effort of activities can give you more benefits from exercise. In addition, especially for people who may work in an office-based environment in front of a computer, or otherwise have work that involves a lot of sitting for longer portions of the day, setting reminders to be up and moving around and sitting less can help contribute to staying physically active. It's also recommended to participate in muscle strengthening activity, like weight training or resistance activity, at least twice a week. This does not necessarily require specific weight equipment or a membership with a gym. There are body weight exercises that can help improve muscle strength that can be done from home. There are several strategies that can help support staying active and getting exercise. Starting out with setting small, realistic goals will support long-term success. Such goals can include setting a goal of daily steps and using a step counter, or setting a timer every hour to get up from your desk and walk around. Walking is an excellent aerobic activity, and finding ways to move throughout your daily routine can help. And these small changes can add up, like parking further from the store entrance, or getting off a bus one stop early and walking the rest of the way, or taking the stairs instead of an escalator. Each of these small actions can add up to more physical activity throughout your day. Making small adjustments week by week to slowly increase your activity can also help support success in staying active. Now, if you have any concerns about exercising or feel unwell during exercise, you should definitely discuss an exercise plan with your primary care clinician. Finally, as we've discussed a few times by now, healthy eating is foundational to supporting heart health. There's a growing body of research studying diet and health in South Asian individuals. Here in the US, South Asian adults who have been in the US and spent a longer time here have higher intakes of high carbohydrate foods like pizza, breads, and pasta, have higher intake of fats and oils, and have higher intake of alcohol compared with South Asian adults who've been in the US for a shorter period of time. A recent study from NYU studied motivating factors for eating behaviors in a sample of second-generation South Asian young adults. The factors that influence diet choices and eating behaviors included an individual's ability to cook, convenience in cooking, and as well as convenience in accessing certain foods such as takeout foods, costs associated with cooking or eating outside the home, as well as emotional responses to eating and preferences about tastes or novelty for non-South Asian foods. How to address these motivating factors to promote healthful eating among South Asian young adults remains an area of active study, and I hope that emerging research will help support recommendations for healthful diet changes for the young adult South Asian population. We've addressed some of these recommendations for healthy dietary patterns so far, but to summarize again, keep in mind that as you try to make smart choices and food swaps, some of these things may be particularly useful to give you a guide. So we highly recommend vegetables, fruits, whole grains, beans, legumes, nuts, plant-based proteins, and for non-vegetarians, lean animal proteins. We recommend limiting sweetened drinks, limiting salt, processed meats, refined carbohydrates, and processed grains like white bread, pastries, and cookies, full-fat dairy products like whole milk or full-fat yogurt, eggs and especially egg yolks, and oils like coconut oil or palm oil, which are high in saturated fat. And we strongly recommend avoiding trans fats and partially hydrogenated oils, which are commonly found in fried foods and commercial baked goods. To help you make dietary choices, I strongly recommend that people learn how to read and understand nutritional labels, which will help you understand what's in the foods that you're eating and how they contribute to your nutrition. Nutrition labels can help you make healthier eating choices. And when you have several choices, it's a good idea to compare the nutrition facts on the labels. Choosing food products that have lower amounts of sodium or salt, less saturated fats, and minimal added sugars are optimal. For more information about reading and understanding nutritional labels, I recommend starting with these websites from the AHA at heart.org/mylifecheck and heart.org/eatsmart. Tips to maintain a healthful eating pattern are outlined here. In addition to knowing what's in the foods you eat, these behaviors can help maintain good heart health. Watching your calorie intake and keeping portion sizes reasonable will help prevent overeating. Cooking at home will help you take control of the nutritional content of your foods. And in many cases, foods prepared at home are more healthful than foods prepared in restaurants. Managing salt or sodium intake can also help maintain heart health, particularly because high salt foods can influence your blood pressure levels. Breads, pizza, prepared sandwiches, deli meats, prepared soups, burritos and tacos are foods that commonly are high in salt, but so are many snacks and foods that are part of the South Asian cultural cuisine, like bhajiyas, sabjis, and packaged snacks that you might find at the South Asian grocery store. One particular aspect of healthy lifestyle and behavior that has emerged in the South Asian community is the influence of social networks. Social networks, meaning the people with whom you have social contact, are increasingly recognized as a contributor to health-related behaviors, and this can be positive or negative. For example, people may have shared dietary norms or eating behaviors. You may frequently have meals with your spouse or partner, your kids, your parents, or your friends. These interactions and shared meals can support healthy eating choices if everyone is motivated to eat healthfully, but can also make people susceptible to making less healthful food choices if others are doing so. For example, if you're dining out with friends or if somebody else is preparing your meals. Similarly, shared physical activity behaviors can influence heart health. South Asian individuals who have partners or siblings who participate in exercise may be more likely to exercise themselves. There's also evidence that South Asian young adults promote exercise in their parents. One recent study from the Masala cohort showed that older South Asian immigrants were influenced by the recommendations and support of their adult children to participate in exercise such as walking. We've talked about several factors of importance to the heart health of young adult South Asians, so let's now take a moment and bring this back to the family that I introduced earlier. What might Rahul and Neha do to protect their heart health? In my clinic, we discussed these recommendations. For Neha, she wanted to focus more on making healthful diet choices, so she and her husband planned to reserve their Sunday afternoons to prepare their week's meals in advance, which will help them avoid takeout foods. In partnership with her OBGYN, she's also going to begin treatment for gestational diabetes. Her brother Rahul visited a preventive cardiology clinic and learned some strategies to overcome his sedentary behavior and increase physical activity to lower his cholesterol levels. After learning how his behavior might influence that of his family's, Rahul arranged a family step challenge for the month, and his family are now participating in a friendly competition to see who can walk the most steps each day. To conclude, I wanted to take a minute to address what's next for heart health in South Asians. For individuals in the audience who are interested in focusing on their heart health and heart disease prevention, I recommend reaching out to your primary care physician and having a conversation about steps that you can take to address your individual risk. And you may consider scheduling an appointment with a preventive cardiologist who can help address specific risk factors. I also recommend joining specific upcoming seminars in this series, which will talk a little bit more detail about some of the things that I talked about and introduced here. In September, discussing more in detail about nutrition in the South Asian diet. In October, discussing more in detail about the metabolic syndrome. And in November, some further details about digital health tools that can help promote heart health. Finally, a brief preview of what's coming down the line for the Masala study, which is the largest community cohort of South Asians in the United States, trying to understand factors for heart disease and heart disease prevention in the South Asian community. Starting this summer, I'm leading an effort to launch the Masala 2G study, or the Masala second generation study, for which we'll enroll young adult children aged 21 to 40 of the South Asian population of children who participated in the Masala parent study. In addition, the Masala parent study will be expanding next year to include more participants of Pakistani and Bangladeshi background to better understand differences in heart disease risk and risk factors between these different subgroups of South Asian Americans. I'll also put a plug in for My Life Check, where you can check your own heart health score from the American Heart Association at mlc.heart.org. And you should work with your primary care physician or your preventive cardiologist to help collect some of the information for this tool. It can be helpful to get an overall picture of your heart health, as well as resources, strategies, and recommendations to move towards better heart health starting early. I want to thank you all for your time this evening, and I appreciate the opportunity to share some of our research and that of others about heart health in young adults and young adult South Asians, and I welcome any questions and look forward to the discussion with the group.
Dr. Shah, thank you so much. This was just wonderful, and I think exactly what our audience has been looking for. So thanks again. It is also challenging for us to think about how early we really need to start to think about heart health and preventing cardiovascular disease. So it's a great way for us to start focusing on this as families even, and multiple generations working together. So we have quite a few questions. I'm going to go ahead and jump in to some of these. So you had mentioned amongst the things, if we're looking at cholesterol and we're looking at heart health, that a doctor might recommend is the coronary artery calcium score. And so a question from Amir Khan is, since South Asians are at higher risk for cardiovascular disease, do you recommend CAC? If yes, what would be the LDL target for a coronary artery calcium score of 100 with no other risk factors? Just a reminder to the audience, we won't give out specific information about your particular health. So if the numbers you're including happen to be personal to you, please still speak with your physicians. But maybe Dr. Shah, just a rough idea of coronary artery calcium score, how you would use it, when you choose to use it in people, and if there's specific LDL targets you then create.
Absolutely. Thank you for that question. So coronary artery calcium, I think, is a really hot area of research right now, and we're learning more and more day by day about when to appropriately use it. The way I think about it, and Dr. Bhatt, I'll welcome your input as well of what you do in your clinic. I often think about it if it's going to help me make a decision one way or another about whether or not a person would be appropriate for a cholesterol lowering medication. And so I do generally recommend individuals consult with their primary care doc or their preventive cardiologist before getting a coronary artery calcium scan, because there can be instances in which a coronary artery calcium scan isn't really all that helpful and isn't really going to change what we would recommend for a person. Often I'll use it if somebody is kind of assessed at an intermediate risk for heart disease. And a lot of the risk assessment tools that are generally available for clinicians aren't specifically identified or validated in people of South Asian background. And so, we do our best with the tools that we have. And sometimes we have to use these added tools to know exactly which direction to go. So often I'll find that if I assess somebody at kind of an intermediate risk, maybe their cholesterol levels are somewhat borderline, their LDL levels are in a range that I would consider average to slightly above average. These are general ranges and everybody's different, but maybe if their LDL levels were in the 120s, 130s, 140s, I would start thinking about that person being in a slightly elevated risk but also taking into account all of their other background, their family history, whether or not people in their family have had early onset heart disease. That can help inform somebody's potential assessment of their risk for heart disease. And to directly answer the question, if I assess somebody at kind of an intermediate risk, getting a coronary artery calcium score can help me reclassify whether or not I think they would benefit from a cholesterol lowering medication. If somebody has coronary artery calcium at a younger age than I would expect them to have coronary artery calcium, that might be a person in whom I would consider starting a medication. On the other hand, if their other risk factors suggest that they're at an intermediate risk, but they have no coronary artery calcium, that might provide some evidence that maybe they would be okay without a medication on the short term, but we should continue to have that conversation over the coming years.
Wonderful. That's incredibly helpful. I think intermediate risk is where many people will say the coronary artery calcium score is helpful. To those who are watching this series and have not seen the conversation that Dr. Shah mentioned that we had previously with Drs. Amit Khera and Ani Patel, they also go into some detail about this, about the personalized approach. As well as some risk scores that might be a little bit better than some of the ones we use in the United States for South Asians. Please also remember when you're using the risk score, if you're a woman, this does not account, and this is for women of any ethnicity, does not account for whether you had gestational diabetes, so diabetes in pregnancy, or hypertension in pregnancy. So if you did, in your mind, remember to mention that to your doctor and check it off as one additional risk factor that counts towards you potentially having heart disease later and needing to work on things earlier. One other commentary, which is I sometimes find myself using a coronary artery calcium score to convince people who I do think need to take a medication that they need to take a medication. It's not the ideal way to use such a test. And so I will remind everybody that when we recommend medications, we are happy to have the conversation with you about what is the risk benefit, what have you read online about potential side effects, and address those with you to make sure that you are comfortable with and then able to take the medications we're giving you if we are recommending them. With that in mind, there is an anonymous question about general LDL goals for otherwise healthy South Asians in their 40s or 50s. So being of middle age, oh, I hate saying about 40s and 50s, but being of middle age and being South Asian, is that risk enough? Where would you put us as an LDL goal?
So that's a really good question. And it's a little bit challenging to have a specific goal identified. And the reason for that is in part because I don't think we quite understand enough about how LDL operates and whether it may operate differently in the South Asian population. And so this is something that I know that several people are actively working on in research in the US and outside the US. My practice is not to specifically focus on just one number. If somebody has an LDL level that is higher than average, if I'm seeing a number that is around 130 or 140, I will look to see what other factors are also present in that individual that might help me better understand whether or not that person is on average at higher risk or on average at lower risk. So if that person has diabetes, if they are at higher weight, if they are a smoker, and this is whether or not that person is South Asian, I might be inclined one way or the other. I will consider South Asian ethnicity, but I won't put that at the top of my list just yet because I don't think we have enough evidence to necessarily use that as a deciding point for something like a medication or not. I will generally look at somebody at a big picture, and I will be influenced to consider somebody at generally higher risk for heart disease if they're of South Asian ethnicity, but it's not the individual thing that I'll focus on. What do you think about that, Dr. Bath?
Yeah, no, it's a great point. So I think otherwise healthy is a great phrase. And so you want to know your numbers always, right? You want to know what your blood pressure is, and you want that blood pressure to be kind of in the 120s over 70s or lower. And so that's one goal that you have. You also want to know that, let's go back to blood pressure for 1 minute. If anytime you're stressed, suddenly your blood pressure is 140s or 150s over 90s, and you say it's only when I'm stressed, in general, think about how many times we're stressed during any given day or week. We don't just let that go anymore. We don't say it's just when I'm stressed. That's something you should be following. So you need to know that. You really want to know what your cholesterol numbers are. You want to know your hemoglobin A1C if you're checking for diabetes or pre-diabetes. And then you want to know your family history. Did people have heart attacks at a younger age? So you can be a healthy South Asian, but with a close family history of people with premature or earlier coronary artery disease or risk factors, that kind of counts against you. So we'll say an LDL, the bad cholesterol, recognizing everything that Dr. Shah just said about us really understanding it better in South Asians, that LDL should be under 130. And I will say if you're South Asian and you can do it by diet and healthful living alone, and you can push it down to 100, that's great. All right. So not necessarily medication, but if you want to make some lifestyle changes and get down to 100, that's great. We aim for a goal closer to 70 if you have known coronary artery disease, if you've known diabetes. And so we'll push it lower for known disease. Okay. So again, less than 130 is your goal. And if you're South Asian and you can do it by diet alone, nothing wrong with trying to push a little lower while we continue to study its importance and what the importance of the other types of cholesterol particles are in South Asians as well. A couple more questions. This goes towards diet, actually. So one question about which diets might be best to reverse type 2 diabetes. And then any thoughts on intermittent fasting or the keto diet that you might have for South Asians specifically?
Sure, those are great questions. So first, I guess I'll address diets with pertaining to type 2 diabetes.
Yeah.
I think the most evidence is probably for the so-called Mediterranean style diet. And that doesn't necessarily mean certain foods, but my big picture approach to a Mediterranean style diet when I'm recommending dietary modifications or dietary patterns to individuals is a primarily plant-based diet that is rich in vegetables and fruits. And when carbohydrates are taken in, focusing to the extent possible on whole grains. And for individuals who are not vegetarian, focusing on lean proteins. So chicken and fish are the ones that I often will discuss with patients in clinic. When having poultry, making sure that it's lean. When having red meat, on occasion, if you do consume red meat, I recommend trimming excess fat and choosing leaner cuts. But for the most part, if you think about the size of your plate, I will recommend 50 to 60% of that plate should be filled with plant-based foods, plant-based proteins, vegetables, fruits, things like that. And then as far as the question about dietary pattern, first I'll address the question about time-restricted eating or intermittent fasting, and then I'll address a question about the keto diet. So, there's a lot of interesting and emerging data about time-restricted eating, and I think the jury's still a little bit out on its effect on long-term health. I know a lot of people will turn to time-restricted eating or intermittent fasting for weight loss, and I found that people actually can get good results for that pattern of eating. My suspicion and my thought on that, having reviewed some of the literature that's recently come out, is that I think the main effect from time-restricted eating is calorie restriction. I think that's really, it's not so much when you eat. So if you're eating lunch and dinner, or you're eating later or earlier, I think really the benefit comes from reducing calorie intake. And so if time-restricted eating helps you do that, I suspect that's where a lot of the benefit comes from. And then,
Go ahead.
Sorry, the last thing I'll say is the keto diet. So I do get a lot of questions about the keto diet in our preventive cardiology clinic. And it's interesting. There is certainly evidence that supports that a ketogenic diet, which is a diet that is fairly high in protein, or a protein-based diet, which often includes a heavily animal protein-based diet, can have benefits for weight loss. But I'm going to put a big asterisk or star next to that, because often people who choose ketogenic diets that are primarily from animal-based proteins will find that their cholesterol levels will not respond particularly well to that dietary pattern. I've had several patients come through the clinic who've managed to lose weight successfully on a ketogenic diet, but come in with LDL cholesterols in the 200s or higher. And so on the short term, ketogenic diet may be helpful for weight loss, but it might be outweighed by adverse changes in cholesterol. Some people are able to attain a ketogenic state or ketogenic diet with primarily plant-based protein, but I think that can be harder to do, and I don't really recommend that particular dietary pattern. the evidence for this particular dietary pattern, I think, is still emerging, but it's not in a place that I strongly recommend it to anyone.
Wonderful. I'm so glad you said several things there, because I was ready to jump in with them, but you covered it just brilliantly. So I think just to go back to the reversal of type 2 diabetes, yes, we have a lot of people who are thinner, whose BMI may not be over, and yet we have diabetes and it runs strongly in our family. And that is challenging, and we keep working at it. However, we have a large segment of our South Asian population that has a lot of what we call truncal obesity, okay? Which is, we may have skinny arms and face and legs, but we really carry a lot of our weight here in the middle. And we start doing that at a younger age. And so again, since we're talking about second generation right now, and kind of kids in their 20s and young adults in their 20s, 30s, and then who become 40, 50, really want to focus on getting rid of that at an earlier stage. I think that's actually really important. And one way to do that is really that calorie restriction. And so I like the idea of time restricted eating or intermittent fasting, because of exactly what Dr. Shah said. It is one way to guarantee that you are going to eat during a certain period of the day, and you are not going to snack in the middle of the night, put in empty calories at other times of day, end up having 5 meals a day because you ate with mom, and then you ate with your sister, and then you had a snack, and then you had chai, and all of a sudden it wasn't a lot of calories at any one meal, but it sure was a lot of calories in the day. So if you're using intermittent fasting really for calorie restriction, I think that's helpful. Now, the ketotic diet, achieving ketosis is no longer using carbs and burning them, right? Decreasing the amount of carbohydrate in your diet such that you're then really going to end up burning more of your fat, okay? There are challenges. So one thing is that a lot of the different vitamins and minerals and other things that are in your body change when you go to such a strict diet. So you have to recognize that you want all of those things to be balanced. And that's very important if you really read about the ketotic diet. People use it for seizure disorders, for other things. It's actually a therapy for some types of diagnoses. If you're using it for weight loss, I would say one thing is just recognize why you're using it. If you're using it to get down on carbs, just go low carb, right? But don't necessarily increase red meat and fatty foods, saturated fats, in order to go low carb. Just try and decrease your carb. If you do use a ketotic diet, you may find that you will lose a lot of weight quickly. When you come back out of it, which you should, and you should not be on a ketotic diet for a very long period of time unless you have another medical reason or have discussed it with a physician or a nutritionist. Remember that you don't want to just rebound, because that'll be very disappointing. So again, you're then going to merge into a low carb diet because you got rid of carbs completely. Now you're slowly going to bring them in a structured fashion. So again, all of this is in moderation. And at the end of the day, there's a lot of discipline that goes into being healthy starting at a young age. But, you know, for people who have real disease, we also have medications that can help you in addition to the diet and lifestyle. And it really helps to have a nutritionist or dietitian. And it is okay to ask for somebody who may understand the South Asian diet. Don't feel that you need to take the first person you get. And that's true for physicians, nurses, dietitians, everybody. Make sure it's somebody who is willing to be culturally interested and relevant in how you eat things. I wanted to read one. So I guess we have a few questions, but we're getting short on time. Ayush has a great question about evidence-based South Asian lifestyle interventions. And I will actually refer you, Ayush, to our interview with the Saheli group. They did a beautiful job at South Asian lifestyle interventions. And so you can Google the Saheli group. You can also look back, and Meg, maybe if we can put it into the discussion, look back on the interview that we did with them just a few months ago, and they did some great lifestyle interventions. There are a couple different ones out there. I do want to read something from one of our students. So Nikita writes to everybody. Hi, and Nikita, we're so excited to have you with us. Nikita is a rising senior in high school. She has been advocating for South Asian heart health for the past few years. She has created an Instagram page called @HeartSmartSouthAsians, if everybody can follow, @HeartSmartSouthAsians. And she is going to be posting a public service announcement with Anupam Kher, Bollywood actor, and Hollywood actor, actually, and Dr. Kanaya at the Masala Study, and herself, and that will be launching this fall. Nikita, please do keep in touch with us, because we would love to also share your public service announcement with the rest of our group. And thank you so much for working on this at a young age. I think we can all give Nikita a silent clap there for doing such a great job. Let me end with one last question. It's a specific one, but I think it's worth bringing up. We have some doctors on the call as well. Which cholesterol test do you recommend, Dr. Shah? LDL-C, ApoB, or LDL particles? Do you have a preference for South Asians just yet?
Yeah, that's a good question. I usually will start with a standard lipid panel, so an LDL-C. And in somebody in whom I am looking for a reason or don't yet have a good understanding of their overall heart risk, I may choose a lipoprotein little a along with an ApoB. I usually will leave the LDL particle sizes and the more advanced lipid testing to somebody who has more expertise in clinical lipidology. I often will find people will come to clinic having obtained those tests and then not quite sure how to interpret them. And so there may be situations where those more advanced lipid tests are useful. I usually don't use them in my regular clinical practice.
Wonderful, wonderful. Well, thank you. Emily has just put into the chat as well. It was the October 2020 webinar that had the Saheli Group's Dr. Namrata Gandula with us. And the link is in the chat for those who want it. Again, October 2020. And you can find more information about the upcoming sessions that Dr. Shah mentioned. And we're excited to hear more about the Masala study as well as you continue to do good work. Dr. Shah, we are at the 8 o'clock hour. This was such an honor. Thank you for spending the time with us, for going through this in such detail and in a way that I think we all have some actionable items that we can go home and make some changes. To everybody in the audience, thank you for watching and joining us today or joining us on a future date when you'll see this. And Dr. Shah, please keep up the great work. Great to hear that you are funded by the NIH, that you are doing so well at Northwestern as an assistant professor there. And we look forward to watching your career as well as how much you're going to help the population. So thank you, everybody, and have a wonderful night.
Thank you all. Have a good evening.